What is syringohydromyelia, you might ask? Well, today we're diving deep into this less-known but complex neurological disorder. Syringohydromyelia, or more commonly known as syringomyelia, is a condition marked by the presence of a fluid-filled cavity, also called a syrinx, within the spinal cord parenchyma, or central canal. The parenchyma, if you're wondering, is the functional tissue in your body. This disorder is a slow burn, causing gradual neurological deterioration over many years. Now you might be thinking, how would I know if I or someone else has syringomyelia? The typical symptoms to watch out for are paralysis, sensory loss, and chronic pain. Paralysis can range from mild to severe, affecting the ability to move parts of the body. Sensory loss often involves a decreased ability to feel heat and cold. And chronic pain, well, that's self-explanatory. But how is syringomyelia diagnosed? It's not as simple as taking a blood test. The diagnosis is a multi-step process involving the identification of characteristic symptoms, a detailed patient history, a thorough clinical evaluation, and a radiographic investigation. One of the most effective tools in diagnosing syringomyelia is magnetic resonance imaging, or MRI, which can classify intramedullary cavities according to anatomic and pathologic types. Treatment for syringomyelia is tailored to the severity and progression of symptoms, with two general approaches: restoring normal cerebrospinal fluid, or CSF, flow around the spinal cord, and directly draining the syrinx. For patients with severe symptoms, surgery is often recommended to eliminate the syrinx and prevent further spinal cord injury. But it doesn't end there. After surgery, physical and occupational therapy may be needed to improve muscle function. In some instances, ventriculoperitoneal shunting or syringosubarachnoid shunting may be needed. So to recap, syringomyelia is a neurological disorder characterized by a fluid-filled cavity within the spinal cord. Typical symptoms include paralysis, sensory loss, and chronic pain. Diagnosis involves a thorough process of symptom identification, patient history, clinical evaluation, and radiographic investigation, with MRI being a key tool. Treatment depends on symptom severity and progression, often involving surgery and post-operative therapies. Syringomyelia is a complex condition that requires careful attention and a comprehensive approach to diagnosis and treatment. But with continued research and advances in medical technology, there's always hope for a better understanding and effective treatment options for those affected by this disorder.